passageways. What this does is it decreases the diameter of the tubes, the passageways, decreasing the airflow, and you have obstruction, difficulty with breathing, and a decrease in air exchange from oxygen to CO2, which is carbon dioxide.
Okay, how do you go about, really diagnosing, the problem? Are there certain tools that are used to do that? You want to go into that area?
Yes. Well, first of all, a patient comes into the physician with some signs and symptoms, which we'll discuss a little in a few minutes. With symptoms, and they think they might have asthma.
Well, let me just tell you about a personal experience I had with my daughter. For many years, we thought she had a bad cold, and we would get Vicks, and we would put it on there, and it would last a little while, and she would get some relief and whatnot. And it kept going that way, just trying things that we felt that were good enough, because we didn't see a real major problem until one day we had to rush her to the hospital, and her breathing almost ceased, and we found out that this was a real problem, and therefore then we got the diagnosis that it was asthma. Okay, and because many times people do that, so there's a concern that I have as to how do you what are the signs and symptoms, and how can you help, what can be done to help ascertain quickly whether it is asthma or some allergy in many cases. Okay?
Right. Well, first of all, a patient will come in and they will question the physician. They think they might have asthma. First and foremost, we do a thorough history and physical, and we might send them for specific tests. We have, again, we do routine blood work. And what we would send is something like this I have right here, which is a peak flow meter. Peak flow meter is what we call a gross instrument that we use. And what I mean by gross is not disgusting. I'm talking about something that is it's specific but not sensitive, meaning it's going to give us just a generalized indication of how the lung or the passageways are doing. This is something that you would breathe in, and we monitor the level, the volume, and it's called a peak flow meter. This is one tool we use. The second instrument we use would be...
Well, give us an idea of how this works, though.
Okay. This is, like I said, it's called a peak flow meter. We set this up, and you make sure there's a little red indication here. All right?
See that.
It slides up and down. Basically, what we would have the patient do is seal the bottom piece here, which we call the mouthpiece. They take a deep breath and make sure they exhale through their mouth and not their nose, and I'll demonstrate it right here. So we're just going to seal it, and you exhale, and we take a measurement. This measurement's based on the patient's weight, and there's a calculation and a formula based on weight and lung volume, and then we make a comparison on a chart to make sure you're within a certain range. And for me, I was 525. So that was my peak flow meter.
Right. So in other words, the air is passing through.
Passing through, yeah. If I had something like 150, then I'm straining.
Yeah, I'd have to take you off the show right now.
That's correct.
And call EMS and do something with it. But this is the first stage of diagnosing. Am I correct?
Well, that's one.
One of the first stages.
Also,
right.
we have your clinical suspicion. Remember, we're clinicians first.
Right.
Then we use diagnostic tools to support our clinical diagnosis. The second, which I will point to here, this is called a spirometer, and this is what we use for pulmonary function tests. This is very specific and sensitive. This is something what we call the gold standard of measuring respiratory diseases. This is, like I said, the peak flow meter is sensitive but not specific. The spirometer here is very specific and sensitive. Therefore, that's why it's called the gold standard for measuring respiratory pathology. So these are really
the diagnostic tools?
That's correct,
okay.
The diagnostic tools. And with the spirometer, what we measure is the large, medium, and small and very small air passages. Very important to have an understanding of the uh, uh, the inflammation that's involved that's affecting the very small passages. That's where we need to treat, and that's our goal. We need to keep the inflammation down in those small passages.
Okay, with small passages, just give us a simplification of exactly where these, looking at a chest of a
Right,
person.
right. We're talking the small passages that are within the lungs. We're talking the very, very tiny passages where the air exchange occurs. We're talking the exchange of oxygen and carbon dioxide. Very, very small passageways where the layer is 1 cell thick. That's how small we're talking.
Because some people see a lung as just one unit.
Right.
Okay, and like a top and a bottom.
Right.
Okay, but it's more than that, am I correct?
Yes, we're getting into we're talking the microstructure. Very small passages. Very small.
Right.
1 layer thick. Not the large tubes that are in our neck
That's what I
that
meant.
go down into the lungs.
Everybody thinks about that,
Yes,
right?
yes. So what we
yeah.
call the trachea, we're talking very, very small. You can't see them. They're within the lungs.
Right.
But
Okay.
we feel them, though.
Right.
Especially when we're having an attack.
And there's where the diagnostic tools help.
That's correct.
All right. Now, we're going to also talk about what causes asthma, because it's got to come from somewhere. Where do people get it from? You know, is it hereditary? Does it pass down? Did my mother have it? Did my brothers have it? Did my uncle have it? Did my great-grandmother have it? You know, we tend to feel that it's passed down.
Right.
All right. Is it passed down?
Well, asthma, yes, there is a genetic component. And what I mean by genetics, as I discussed in previous shows, genetics, I'm referring to your mother, your father, your aunts, your uncles, your family, your lineage, your genes, things that are passed down genetically. Yes, there is a direct correlation. Also, there is a correlation with allergies, increased allergies. Those people who have a heightened sensitivity and who have seasonal allergies, they have a tendency to have, again, hypersensitive lung tissue, again, part of the asthma. Not necessarily meaning that they're going to have asthma or they have asthma, but they have an increased risk. Also, patients who are born with lung pathology, there's a link that increases the risk for developing asthma, as well as environmental influences.
Yeah, I was just thinking about the old school buildings and old tenement buildings and like that, where there's a lot of either asbestos or dust and things like that. Could that bring on asthmatic condition?
Yes, it's been documented it can bring on asthma. You may have an asthma attack. It doesn't necessarily mean you have asthma. So that's something, again, to think about. Just because you're exposed to something doesn't mean that that you're diagnosed for asthma your entire life. You might have just been exposed to something like a lot of dust, or let's say, I give an example. There was a severe rainstorm and your roof collapsed. Another example, which is pretty common, is the bathroom in the tenements from the leaking of the apartment above, where the ceiling has a tendency to fall down, and you have exposure to all the dust that's been building up for years. You inhale this dust, and you can have a reaction where you have the inflammation in the lungs, and you can have an asthma attack, but it doesn't necessarily mean you have asthma.
Now, would you suggest that persons having any kind of breathing problem come in for a screening?
Yes, I do.
You do?
Again, a thorough history and physical.
And that's done at All Med?
Yes, we do. We perform that.
All right, and now we're going to get to the area of treatment, and but before that, I want to deal with the immune system in relation to what causes asthma. Can you go back into that, the immune system? That is the growth of the lungs, the immune system, and the environment, but basically the immune system.
Some studies demonstrate that individuals who are born with a decreased immune system, immature lungs, have a higher risk of developing asthma. Not to say that you're going to develop asthma, but you have an increased risk for developing asthma. Part of the immune system is to fight foreign bodies, antigens,